we can all agree that bad things happen to us every single day. We can stub our toe on a coffee table, or we can have a flat tire on the way to work on a Monday. What is the difference between something bad happening versus something traumatic? A traumatic event stays with you. And what I mean by that is that it could change the way you view yourself. It could change the way you view the world. It could also affect other areas of your life, such as trust, safety, self-esteem, power and control, and your ability to establish some sort of intimacy. It comes out in the form of repeated intrusive memories, such as flashbacks and nightmares. If you're exhibiting signs of avoidance, right? Avoidance of any reminders of the traumatic event, or avoidance of people, places, things, activities that remind you of the traumatic event. If you're having negative thoughts about yourself and the world, or if you're experiencing things like arousal symptoms, such as, anger outbursts or hypervigilance, I would encourage you to seek help. So one of the things I treat here often are service members who have experienced some form of combat-related trauma. For example, I had a service member recently who was part of a convoy. There was an explosion. Fortunately, she was able to get out. Unfortunately, many other service members were not. And so she felt overwhelming feelings of guilt and shame. She was constantly reminded of this event in the form of intrusive memories. They would play back in her mind. She would be reminded by certain smells, certain loud sounds. She's experiencing just feelings of anger and irritability, and it's coming out in forms of outbursts, right? Because of that, maybe she's isolating and withdrawing a little bit more and pushing people away, right? So now her support system has been affected. We definitely teach grounding techniques, mindfulness, deep breathing. We come up with plans to help attack these triggers head on, to avoid them altogether. We create all kinds of ways to tackle the problem. That way the person can live a normal, healthy life, and that other areas of their lives aren't affected. I think the first thing I would recommend is to always let a friend or family member or someone in your support network know how you're feeling. If that's not able to resolve it, I would recommend a facility just like ours. We can come get an assessment and we can determine the appropriate level of care that's needed. A lot of times, people that experience these events learn to avoid going into crowded places. They avoid talking about the event. What we do is we create a space to allow this person to talk about what actually happened, to no longer avoid the situation. And in doing that, in a group environment, other people are hearing her story, or other people are sharing their stories and offering different perspectives and letting her know that she's not alone in what she's experiencing. We also offer individual trauma-focused therapy in the form of cognitive processing therapy or prolonged exposure, which is targeting some of those maladaptive beliefs that have interfered with her trauma recovery, right? That is leading to feelings of guilt and shame, in the hopes that if we can challenge some of those negative thoughts, that they create more positive emotions and she's able to navigate the world outside of her trauma.